Hi everyone, my name is Matt from MR Safety Training, and we've been asked to come along and do a few basic first aid items situations that you may come across, so you know how to keep safe and you also know how to help someone else who's in need. So we're going to go through a few different situations. So a bit of choking, a bit of bleeding, a bit of what to do if you had a burn, and a bit about unconsciousness as well. If you find someone on the floor, or if someone's not breathing, then what to do then? Okay, so first of all, a bit of bleeding. Okay, so if you were to come across someone with a bleed, or maybe you've cut yourself, okay, the most important thing is to apply pressure as soon as possible. So sit down, or sit the person down if it's someone else. Have a look at the injury. If there's anything inside it, make sure you wash it with running water or some clean water. If you're outside, it might be a bottle of water or something, and then apply pressure on the wound itself. Okay? And that could be with anything that you have on you. It could be a sleeve, it could be, a few weeks ago I cut myself and I was out with a dog, and I used a dog poo bag, okay, and just wrap that around. So you'd use anything that you can. Ideally, you would use a dressing, okay. So these are dressings that you would find in the normal first aid kit. So you might have a first aid kit in the home, maybe. So you'd unroll this to the pad, okay. You would apply the pad on the wound itself. Remember, it has to be a clean wound with no big objects inside. If there's a big object inside a wound, then you won't be able to put pressure straight on, because that would push any objects further in. So the pressure would be applied at the side of the object instead. Okay. So if it's a clean wound, say I've cut my arm, say, so it'd be sat down. If we were getting dizzy or if we're getting pale, then I'd be on the floor with legs raised. Okay, and that just helps the breathing and it helps blood to circulate back to the brain as well. Okay, so a pad is applied on a wound, like so, and then we would wrap the bandage around the wound, okay, around the pad, okay. Make sure it's all nice and sealed so no infection can get in, and also make sure we have enough pressure on to stop any blood pouring out, okay. And then once we reach the end of the bandage, we then tie the two ends together, like so, and then tuck them in. Or apply a bow, double knots, whatever you fancy. Okay. If blood came through that dressing, we'd put a second one on top with a bit more pressure. And if blood came through all that, then hopefully we'd be on our way to hospital. It'd be quite a deep wound, and then we'd reapply, take it all off, and reapply again with something fresh, nice and tight, and then maybe something on top of that one. Okay, with a dressing maybe. All right. So when we're treating a bleed, just make sure we have a look at the wound, make sure we sit the person down, or if it's yourself, you sit down, and then apply whatever you can on the wound, ideally something sterile like a dressing.